Welcome to this Pelvic Health 101 workshop. My name is Cannata. I'm a physical therapist with a women's pelvic health focus. A little bit about me. I grew up here in Stillwater. I went to Oklahoma State for my undergrad. I went to Tulsa for physical therapy school. After Tulsa, I moved to North Carolina for 3 years, where I completed a 1-year orthopedic residency. I then moved back to Tulsa, where I worked in an outpatient orthopedic clinic. I met my fiance, now husband, and moved back to Stillwater. I'm so excited to be offering pelvic health women's services in Stillwater and the surrounding community. For my presentation today, my overarching goal is to educate. I want to educate you on what pelvic health is, what the pelvic floor is, and what pelvic physical therapy is and how it can help. Some other goals I have, I want it to be interactive. We're going to do 2 exercises today that help bring awareness to what your pelvic floor is, where it is, and how it moves. I mentioned I want it to be educational. I also want it to be motivational. We come from a school of thought in our society where a lot of pelvic health symptoms are deemed normal. For instance, if you have had children and you leak urine when you cough or sneeze, you may have been told by a healthcare provider or friends or family that that's normal. Well, I'm here to tell you it's not normal. It is common, but not normal. So I want to motivate you to get curious, ask questions, and be an advocate for yourself. I also want it to be helpful. I want you to take something away from this presentation. I want it to be empowering. I want you to know that you're not alone in symptoms that you may be feeling now, or symptoms that you have felt in the past, or if you're just curious about what pelvic health is to prevent symptoms in the future. So you're not alone in what you're feeling. I want it to be supportive. I want you to know that there is help out in our community of Stillwater and surrounding communities that can help you through what symptoms you're feeling or what you've gone through in the past. So a couple things we're going to talk about today. The first one is what the pelvic floor is, what the functions of the pelvic floor are, managing intra-abdominal pressures, breathing in the pelvic floor, common pelvic conditions, and what pelvic physical therapy is. So the first question is what is the pelvic floor? So at home, if you want to jot down 1 or 2 words, a sentence or less on what you think the pelvic floor is. And if the first thing that has popped into your head is Kegels, I'm here to tell you that's correct, but it's way more than Kegels. Pelvic health is a lot more than Kegels or contracting your pelvic floor. So I'm going to educate you on that a little bit today. So for the simplest definition, and we'll pick apart this definition so you can fully understand what the pelvic floor is, it's a group of muscles that control bowel, bladder, and sexual functions. So the nature of figuring out where the pelvic floor is, we're going to have to get into a little bit of anatomy. So if you're not keen on anatomy, you don't really know much about the body, that's okay. I'm going to keep it simple in terms where you can understand what you're looking at. So right here we've got our body. We've got our rib cage right here. We've got this muscle, which is our diaphragm, which helps us breathe, and we'll talk about the diaphragm a little bit more. Here is our abdominal cavity, and you're looking here at the deepest core muscle. Then we've got our pelvis, our hips, and then we've got our legs right here. So we're going to focus in on the pelvis right here, more specifically this inlet. This is where the pelvic floor muscles live. All right, so before we look at this picture, I'm going to orient you to this picture with my model here because it's easier to see. So if this person were to lay on their back, then you're looking up at the body here. You're looking up towards the head. These are this is the pelvic floor right here. And so I'm going to orient you to some of the structures that you're viewing. Right here, these are our sits bones, or the bones that you feel when you sit on a chair or a hard surface and you feel that bony contact. That's these bones right here. We've got our tailbone here in the back, and then in the front, we've got our pubic bone. All these structures that are red, that is the pelvic floor. And going back to our definition, there's actually 3 layers of the pelvic floor. and it might be hard to appreciate the layering here. This is, we're going to talk about the 3 holes. You'll hear me talk about the 3 holes a lot in this presentation today. So let's orient you to those. This first one is the urethra. This is where pee or urine comes out. We've got our vaginal opening here. This is our middle hole. And then we've got our anal opening here where fecal matter comes out. So I want you to appreciate how the pelvic floor muscles are so closely related to these 3 holes. So going back to our definition of the pelvic floor controlling bowel, bladder, and sexual function, you can kind of start getting an understanding of how these muscles can control these holes. Okay. So looking up here at our picture, to orient you again, we're looking up the body. We've got our sits bones right here. These are the bones that you feel when you sit on a hard surface. You've got your tailbone here, and then at the top, you've got the pubic bone. So our 3 holes, starting in the front, is our urethra, where urine comes out. We've got our vaginal opening in the middle, and then we've got our anal opening here where fecal matter comes out. Okay, so again, just get the appreciation of the pelvic floor and how they're related to these 3 holes. Okay, so to orient you with the pelvic model for this picture, if this person were to now lay on their belly, we're looking down towards the feet here. So we're looking down the body. This is actually the deepest layer, the 3rd layer of the pelvic floor. So when you hear about pelvic floor, a lot of people think about the support layer, and that's this deepest layer here, and we'll get into that here in a second. So you're looking down at the pelvic floor here. All right, so if we were to take the bones away and just are left with the muscle of that 3rd pelvic floor layer, and we turn it, we get this shape right here. So if you've heard of like the pelvic bowl, pelvic hammock, pelvic sling, it's because of this shape, this bowl-like shape here. If you think about a hammock and someone lays in the hammock, it has to support that body, the weight of that person. So same thing with the pelvic floor. This 3rd layer has to be able to support pressures that are placed down on the body, or if a woman is pregnant, it has to be support the growing baby. And so just get the appreciation of how this 3rd layer is bowl-like or a sling or a hammock. Okay, so before we find our pelvic floor, now we know where the pelvic floor is. Now I want to tell you how the pelvic floor moves, how it contracts, relaxes, and lengthens. So similar to our bicep muscle, we can voluntarily contract our bicep, we can voluntarily relax our bicep, and we can voluntarily lengthen our bicep or stretch that muscle. So same thing with the pelvic floor. We can contract our pelvic floor, we can relax it, and then we can lengthen our pelvic floor. So if you look up here in this middle picture, if we think of the pelvic floor like a trampoline, and this black part is the muscle part. So right now, we're at 0 or neutral. It's not doing anything. If you look at this picture here, it might be hard to see, but as soon as this person jumps off the trampoline, that black or muscle part is going to come up a little bit. We're going to call that positive or a contraction. Okay? And then it has to be able to relax back down to neutral from that positive position. And then if you look at this picture, if this person here is standing on it, so if there's a weight placed on the muscle, it gives a little bit. You see it descend. And we're going to call this negative or lengthen. So we contract our pelvic floor, it comes up. We relax our pelvic floor, and then lengthening, it comes down. Okay? So let's find our pelvic floor. I want everyone to sit up nice and tall in your chair. Okay, so we want maximal contraction with our vagina and our anus and those tissues onto our chair. Okay, so make sure you're not slumping in your chair. Sit up nice and tall. And we're going to contract the pelvic floor. So there's different cues we can use here. I'm going to tell you to stop the flow of urine or stop the flow of gas. okay? So go ahead and try that. Try that contraction like you're stopping the flow of urine or stopping the flow of gas. And what do you feel? Do you feel those tissues move or lift up off the chair? Once you relax, do you feel more contact with those tissues in the chair? If you're having a hard time feeling it, you can bring your hand in between your legs with your palm up, and then slide your hand back and do the same thing. So you're going to contract that pelvic floor or stop the flow of urine or gas. You're going to relax. Do you feel the movement? Do you feel something moving up off your hand? Do you feel it relaxing back down into your hand? Okay, so try that a couple times and see what you feel. Now we're going to add a cough, a sneeze, or a laugh, and this changes the pressure in your abdomen and it puts more pressure down on your pelvic floor. So let's try a cough. All right, go ahead and try that. What do you feel? Do you feel the tissues pushing down into your hand more? Do you feel your pelvic floor kind of contract and protect against that increase in pressure? All right, try that a couple times. You can do a laugh or a sneeze if it helps. The third component, which we're going to talk about the diaphragm and the pelvic floor quite a bit today, but we're going to add in the breath. So now I want you to take a deep inhale, and when you exhale, you're going to contract your pelvic floor. So contract that pelvic floor. Some of you might actually feel that's easier to feel or to contract your pelvic floor. And it's because we're adding the diaphragm we're recruiting the diaphragm, and it's allowing the pelvic floor to contract easier and stronger. All right, so try that again. So inhale in, and then exhale and contract. Okay, so try that out a couple times as I'm going through the presentation. All right, so picking back up here, let's go ahead and talk about functions of the pelvic floor. We've already touched on this a little bit. The first function is support. So to orient you here to this picture, this is a side, so we're looking at someone from the side. And appreciate here's the pelvic floor. Again, appreciate that bowl-like shape or that hammock-like shape. And then we've got our pelvic organs. So here's our bladder in the front. This is where urine is stored. We've got our urethra here and our urethral opening. And then we've got our uterus here, our vaginal canal, and then our vaginal opening. That's the middle hole. And then we've got our rectum and then our anus where fecal matter is voided. And this is the third or the back hole. All right, so I just want you to appreciate again how the pelvic floor is having to support these organs. And then also, like I mentioned earlier, if a woman is pregnant, the pelvic floor has to support the growth of that baby. Okay. So the second function is sphincteric. This just means opening or hole. So we've talked about those three holes. Let's look at this again. And this is actually the first layer of our pelvic floor. So to orient you here, we've got our urethral opening here, our vaginal canal here, and then our anal opening here. Okay? So again, just appreciate how these muscles almost form these holes. So if you were to think about the pelvic, this layer contracting, you would think about those holes getting smaller or closing to stop urine or fecal matter. If the muscles relax, then those holes were open. Okay. So this is another image just to show this. This is actually the second layer of our pelvic floor. And again, just look how closely those pelvic floor muscles are in relation to our urethra here and then our vaginal opening here. So if you look at this muscle, the top muscle here, and it contracts, it would be closing the urethral opening. Okay. The third function is sexual function. So if we look at our clitoris here, which is our pleasure center, we've got our pelvic floor muscles. Look how close they are to this clitoris. And actually our first layer of the pelvic floor helps pump blood to the clitoris so we get more pleasure when we have an orgasm. Also, it functions during pregnancy. Like I've mentioned several times, when that baby is growing, it's got to help support that weight. And then during birth, especially a vaginal birth, when the baby comes out, the pelvic floor muscles have to lengthen or go negative in order for that baby to come out. Also, if you've had a C-section birth, if you've labored a little bit before you went and got the C-section, then the pelvic floor was also having to lengthen, and so it was still very much involved too. So the next function is stability. The pelvic floor is part of the deep core system. So a lot of people have heard about how important it is for you to have a strong core. And so if we look at these 4 components here, this makes up the deep core. At the bottom is our pelvic floor. At the top is our diaphragm. And then the back we've got our spinal muscles. And then our transverse abdominis muscle is that deepest core muscle, and it kind of wraps on the side and comes in the front. So these 4 components make up our deep core canister, and we'll talk a little bit about that here in a little bit. And then the last function is sump pump. So all I want you guys to get away from this is appreciate the density, or how many blood vessels are in the pelvic area. Also, how many lymphatics, which lymphatics are just our defense for infection. How many lymph nodes are in the pelvic area. So there's a lot of blood and lymph fluid that is being pumped through the pelvic area, down to our legs, up to our extremities, and back to our heart. All right, so let's talk about managing pressures, specifically intra-abdominal pressures. So if we look at this Coke can and think about this Coke can as a nice pressurized controlled system, right? If you pop the top, you let the pressure out, you can dent that can. So if we take the bottom half of this Coke can and bring it over here to our abdominal canister, it resembles the shape of a Coke can, okay? So it's a nice, contained, controlled canister. Again, at the bottom of this canister is our pelvic floor, at the top is our diaphragm, and then we've got our spinal muscles, and then the transverse abdominis, that muscle that wraps on the side into the front. And so these 4 components have to work together and be strong individually in order to stiffen or stabilize our core when we're moving our arms, our legs, when we're picking up heavy weights, or picking up any kind of load. These 4 components have to work together in order to make that happen. And we'll talk a little bit about the diaphragm and the pelvic floor and the relationship of those 2 in this canister. Okay, so let's get into that. Before we do this next exercise, the diaphragm and the pelvic floor are the top and bottom of that canister, right? So you can kind of think about the diaphragm and pelvic floor relationship as almost like a catch and release. So when you inhale, the diaphragm goes down and the pelvic floor has to lengthen or respond to that increase in pressure down. When we exhale, the diaphragm passively moves up and the pelvic floor contracts up. So if you think about kind of this give and take system or catch and release system, when the diaphragm moves, the pelvic floor has to move to accommodate. When the pelvic floor gives some contraction up, the diaphragm needs to move a little bit too. And then of course, bringing in those other 2 components to the core canister makes that a nice controlled system. So if we look at this first picture, this is the correct posture, right? This is a nice stacked rib cage with pelvis, and our core canister is nice and controlled and able to respond to any pressures. So if we get a spike in abdominal pressure with a sneeze or a cough, you see a lot of pressure going down, but the pelvic floor is able to respond because it's in good position, it's working properly, it's effective, and it can meet that same pressure load, and you get no leaking. But if you look at these 2 pictures here, so a lot of us can maybe relate to this middle picture where we're slumped over, our shoulders are rounded and our head's forward, and we're typing on our computer. So this changes the shape of our core canister. It doesn't allow our diaphragm and our pelvic floor muscles to adapt to load very well. And so when that happens, if there's a spike in pressure downwards, then the pelvic floor is not in great position and it might not be able to respond well. And so it leads to leaking. So same thing with this picture right here. So for instance, if we have a mom who's pregnant in her third trimester, and she's kind of in this position here to make room for the growing baby, if she coughs or sneezes, her core canister is not in great alignment. And so when she coughs or sneezes, there's pressure down and that pelvic floor might not be able to contract well to accommodate for that pressure. And so we would get leaking. That's just one example. Okay, so diaphragm and pelvic floor work really well together to be able to accommodate abdominal pressures. So let's go ahead and do this next exercise. So at home, if you have a balloon, go ahead and go get a balloon. If not, you can just use a closed fist and I'll show you how to do this. Okay, so go ahead and sit back in your chair nice and tall. Make sure we have optimal contact with our chair. So what we're going to do is we're going to increase abdominal pressure by blowing into a balloon or into your fist. So go ahead and do that. Okay. Do you feel that increase in pressure? Right? What does your pelvic floor do? Do you feel the pelvic floor contract to kind of guard against that increased pressure? Do you feel the pelvic floor pushing down into the chair? Or do you leak when you do this? So now we're going to change up the posture. I want you to try kind of a slumped posture and do the same thing. Okay, what do you feel with that? Do you feel more pressure going down and so you have to contract your pelvic floor harder to kind of guard against that? Or do you feel the pelvic floor pushing further down into the chair? Do you leak when you do that? Try that next posture too and see what you can feel as you change postures. So paying attention to just increasing that abdominal pressure and seeing how your pelvic floor responds to that. Let's talk about common conditions. So these are, this is not an inclusive list. Again, this is just common, these are common conditions that we can see in pelvic dysfunctions. The first one we've talked a little bit about, incontinence. This is urinary or fecal leaking. Okay. Diastasis recti, this is most common after pregnancy. This is the separation of the abdominal muscles because of that stretching of the tissue that's between here. Pregnancy pain, this might include low back pain, pelvic pain, right? Postpartum pain and recovery. So if you had scar pain from your C-section, vaginal tearing during birth, we've got to retrain your body back to optimal posture. So going back to that posture here, we call this a rib flare, and this is really common for pregnancy and postpartum women. If you're kind of stuck in this position after giving birth, then pelvic physical therapy can help retrain that optimal posture to get your canister working effectively and efficiently. Okay. Also, so prolapse can be a pelvic dysfunction. This is a uterine prolapse. So prolapse is basically just dropping of a uterine organ or a pelvic organ. So here is the uterus. You can see the uterus is supposed to be here and it's dropped down. There's different factors that go into prolapse, but one factor is pelvic floor function, okay? And so here you'll see a bladder prolapse. Not sure if you can see that, but you can see how the bladder is kind of encroaching on that vaginal canal, and you might think of some issues that could arise with this, like pain with penetration, difficulty with sex, urinary retention, things like that. Or just pain, so pelvic pain, abdominal pain. You can have low back pain, sacral pain, hip pain, or tailbone pain. And then sexual dysfunctions, you might have pain with intercourse, symptoms with penetration, and pain with orgasm. Okay? So now let's talk about pelvic health physical therapy. Pelvic health physical therapy is a non-surgical rehabilitative of dysfunctions in the pelvis. And big themes of pelvic health physical therapy are assessing the pelvic floor. So just like if you were to come into physical therapy for neck pain, we're going to assess muscles around your neck. So for instance, your upper trap muscle here, this might have tender points, trigger points, or knots that we need to address. We would look at your range of motion of your neck, how you move your neck, and the strength of muscles around your neck. So same thing with the pelvic floor. We would be looking at how your muscles are functioning. You know, are there tender points? Are there knots in the muscles that we need to work out? How strong are those muscles and the coordination of those muscles with your diaphragm and with your back and with your abdominal area? Most pelvic PTs are trained in internal vaginal and or rectal assessment. So this is not the same assessment when you go to your OBGYN and get a pelvic exam. We don't use tools, we use our fingers, and we're going in, say, for example, vaginally to assess the muscle. Okay, so that gives us a really good position to assess different muscles, ligaments, tendons, and seeing how the tissues feel and how it is able to contract, relax, and lengthen. Also assessing the deep core function, so going back to that core canister, you know, how are those four components functioning? Are they individually strong? Are they working together? Is that coordination there? We would be looking at breathing mechanics, so looking at your diaphragm and your thoracic area. We'd be looking at assessing pressure management and looking at the body as a whole. So when someone walks in, we would be looking from toes to head. Just because you have area, you know, pain in your pelvic area, it's a whole system. You know, everything's connected in some way. And so we need to look at from your feet to your head to make sure that the whole system is working. So I have started Core Complex Physical Therapy here in Stillwater. I do have a women's pelvic health focus. I am cash pay. I am based out of Next Level Gym and Indulge Salon. So if you don't know where that is, here's a map. Here's 6th Street right here. We've got the mill on this side, and then we've got Walgreens right here. So it's right off 6th Street, off of Lowry, 6th and Lowry. I offer one-on-one sessions in a private room because a lot of this it could be emotional, it's intimate, and so all sessions are one-on-one in a private room. If you want to learn more about who I am, what I treat, you can go to corecomplexpt.com, and this will take you to my website where you can find my bio, you can find my services, and if you're interested in scheduling an appointment, you can fill out that Contact Us form. That'll email me directly, and then I will reach out to you with all my patients, I do a free 15-minute discovery call. Basically just talking through your symptoms and what you're experiencing to make sure that pelvic health physical therapy is what you need next, and making sure that it's something I can help you with. And if it's not, then my goal is to find someone in the community or your community or surrounding communities that can help with what you're experiencing. So my plan is to do future workshops, and some of these are just a couple topics that I'm thinking about doing next. At the bottom of this recording, you should see my email address. If you are interested, if you took a lot away from today or you learned something, you enjoyed it, then email me what you would like to hear next. So we've got some options like urinary incontinence, postpartum recovery, diastasis recti, body changes during pregnancy, breathing, or if you have another topic that's not listed that you're interested in, please feel free to email me with your feedback from today, and then email me with any other topics that you're interested in learning about. Okay, so if you have questions, again, you can email me with that email that's at the bottom. I hope that you enjoyed today. I hope you took a lot away from this, and thank you so much for watching this. I hope to see you at my next workshop.